Varicose veins. Varicose veins, also called varicosities, are veins that are abnormally dilated and tortuous, superficial veins caused by incompetent venous valves. Most commonly, this condition occurs in the lower extremities, the saphenous veins, or the lower trunk. However, it can occur elsewhere in the body, such as esophageal varices. Varicose veins may be considered primary without involvement of deep veins, or secondary resulting from obstruction of deep veins. Let's start with the veins in the legs when you're standing. Now for the blood to get to the heart, it has to go up, which is working against gravity. So when the calf muscles contract and squeeze the blood inside, some blood gets propelled downward, while some gets propelled upward. But then gravity pushes that upward moving blood back down. Most veins also have one-way valves. These valves only let blood move in one direction, toward the heart. So now, as the skeletal muscles contract, it squeezes the veins. And this lower valve stays closed to prevent blood from going downward, while the upper valve lets blood through, but even though gravity wants to push it back down. That blood isn't allowed to fall back down through the upper valve. For some people, the downward gravitational pull on blood causes the walls of the leg veins to stretch apart over time, which tends to also pull apart those valves. If these valves fail to close properly, they can now allow blood to leak backward and pull in the veins, which can lead to more valves stretching out and failing. The veins have now become varicose veins. And from this additional blood, they start becoming tortuous or twisted. Symptoms, if present, may take the form of dull aches, muscle cramps, and increased muscle fatigue in the lower legs. Ankle edema and the feeling of heaviness of the legs may occur. Nocturnal cramps are common. When deep venous obstruction results in varicose veins, patients may develop the signs and symptoms of chronic venous insufficiency. The duplex scan, which documents the anatomic site of reflux and provides a quantitative measure of the severity of valvular reflux. Air plethysmography measures the changes in venous blood volume. Venography is not routinely performed to evaluate for valvular reflux. When it's used, however, it involves injecting an X-ray contrast agent into the leg veins so that the vein anatomy can be visualized by X-ray studies during various leg movements. The condition is most common in women and in people whose occupations require prolonged standing, such as salespeople, hairstylists, teachers, nurses, ancillary medical personnel, and construction workers. Hereditary weakness of the vein wall may contribute to development of varicosities. And it is not uncommon to see this condition occur in several members of the same family. The leg veins dilate during pregnancy because of hormonal effects related to distensibility, increased pressure by the gravid uterus, and increased blood volume. Pressure and elevation keep bleeding at a minimum during surgery. Bed rest is maintained for 24 hours, after which, the patient begins walking every 2 hours for 5 to 10 minutes. To maintain blood flow in the leg. Elastic compression stockings are used to maintain the compression of the leg. They are worn continuously for about 1 week after vein stripping. Especially knee-high stockings are useful. The patient should avoid activities that cause venous stasis, such as wearing tight socks or a constricting panty girdle. Crossing the legs at the thighs and sitting or standing for long periods. Changing position frequently, elevating the legs when they are tired, and getting up to walk for several minutes for every hour promote circulation. Swimming is also good exercise for the legs.